Okay, hello everyone. Our bacteria is called Actinomyces Israelli. My name is Parmeet.
I'm Chloe.
Asli.
So Actinomyces Israelli is a bacteria that's commonly found in everyone's body, especially in the nose and in the throat. These bacteria typically belong to our commensal flora, especially in our oral pharynx, so in our sinuses, in our gastrointestinal tracts, and in our urogenital tracts. These bacteria are known as opportunistic bacteria, which means that they will not cause an infection until they have the opportunity to. And so symptoms for infection begin after these bacteria enter the tissues after some type of injury or trauma.
All right, so with cell structures of Actinomyces Israelli, they are going to contain a cell membrane, as do all prokaryotes and eukaryotes. It's going to protect the cell from its surroundings, and it's also going to determine what molecules will enter or leave. And then also it's going to have a cell wall, which is going to contain muramic acid, which is an amino sugar acid. And what that's going to do is it's going to help with the structural component of the cell wall. And then with capsules, outer membrane, and the endospores, that is not present with Actinomyces Israelli.
The cell structure of Actinomyces Israelis, it will be the phloem is surrounded by the outer cold hair covering the surface, and the fibula is not present. The pillar will also be not present. The nucleide will be not be present, but the ribosome is present. It has 16 ribosomal RNA sequence in the Actinomyces bacteria.
Okay, other cell structures include transport proteins. However, our bacteria does not have these. Transport proteins are proteins that serve the function of moving other materials within organisms. So these proteins would help move certain molecules through the cell membrane. We also have porin. Porin is a type of protein that helps to transport materials. It creates a pore in the membrane that helps for materials to come in and out. However, porin is not present within our bacteria. In terms of mycolic acid, Actinomyces Israelli is non-acid fast, as shown by the stain. Therefore, it does not have mycolic acid in its cell wall. And lastly, there's inclusions, which are little deposits of lipids, starch, or other compounds. So like in this top right picture, we have the little green dots that are visible, and then you zoom in, and these are deposits of materials that are held in the cytosol until they're needed to be used. But our bacteria does not have any of these cell structures.
Okay, so with morphology and arrangement, Actinomyces is going to be a Gram-sine positive bacteria, meaning they have a thicker peptoglycan layer than gram-negatives, which don't retain the stain as well. And as previously mentioned, it's going to have a non-acid fast. Its morphology is going to be bacillus, so it's going to have a rod shape versus the coccus, which is more of like a round spear shape. The arrangement is streptobacillus, and the size ranges from 0.2 to 1 micrometers to about 2 to 5 micrometers at maximum. And also the Actinomyces is going to grow better without oxygen, meaning they're anaerobes. And then if you look at the bottom right-hand side picture, you'll see that the Actinomyces, when looked at, it's going to show more of like a white plaque, like tooth-like figure.
Actinomyces Israelli disease has a lump jaws, which is the most common portal in the entry of the body, as you can see on the left side of this picture, where this comes forward. And also it has a toric actinomyces in the pulmonary disease from the aspiration of oral exhalation. The abnormal actinomyces is the disease that is the result from trauma or from a break of the muscle, which you can see on this picture on the right side. The urea adhesive is the application of a certain type trauma device, which you can see on the side also, and it also has a common symptoms, which will be the longest term infection that cause sores or abscession in the body of soft tissues, which usually can be found on the mouth, nose, throat, lungs, and stomach, also in the intestine.
Okay, and that was our presentation. Thank you for watching.
Thank you.